Thank you, Mr. Chairman, and this has been a very interesting discussion. Look, our healthcare system wasn't perfect before the Affordable Care Act, but as was indicated by pretty much every speaker today, even you, Mr. Kreitler, and I appreciate your saying this, you know, many of the pledges and promises that were made just haven't been kept. And you could say, well, that's because of overpromising, and it still means that this is an improvement. But I got to tell you, for a lot of my constituents, it's not an improvement. It's created more problems for them, and it's not just higher costs. You know, it is people losing their insurance. We haven't even talked about the co-ops, which is part of Affordable Care Act, and this committee's done some good work on that, as well as our subcommittee. And you know, we've got tens of thousands of Ohioans who've lost their coverage under the co-op because, you know, pretty much every few weeks another co-op goes under. And so this has been tough for people. I've got 30 specific examples here of constituents I brought with me today out of, you know, the hundreds we've gotten, because we have a portal on our website where people can tell us their experience. And I'm not going to go through all of them because I don't have time, but all I can say is it's not just this theoretical issue that's, you know, a debate about health care policy. It's about people's lives and their families and their inability to get insurance that covers them. And so I think you've done a good job, Lieutenant Governor Taylor, today in talking about the numbers, but behind those numbers are people. So here's Chad from Archibald. The plan we had when Obamacare signed the law, the one we liked, was canceled at the next renewal. Companies said no longer able to do it due to the law's passage, didn't meet the requirements of the law. Promised you could keep our plan if we liked it. Promised lower rates. Our premiums have risen 92%, he says. And we keep raising deductibles to keep it from going up more. And I hear that a lot back home. People say, yeah, I've got health care coverage, but really I don't, because my deductible is $5,000, $7,000 now. And that means it's like I don't have coverage. One thing that I think we should point out, and I couldn't agree more with Senator Carper and others who spoke, said we need to do this on a bipartisan basis. That wasn't done with Obamacare, obviously, as Senator McCain, who was here at the time, talked about. I wasn't here at the time, but I saw it being shoved through. But we've got to figure out how to deal with this issue of not just the cost, but the quality of the care. And competition is going to help with that too, right? So let's talk about the competition for a second. You gave us some troubling testimony today, Lieutenant Governor Taylor, and you talked about the fact that you're seeing a big increase next year. I think you said these rates are about a 12 or 13% increase next year. I mean, who can afford that? This is in the exchanges, individual market exchange. You said it's gone up 91% since the 2013-2014 time period?
Yes.
Wow. What do you see happening in the future? What's it going to be in 2018, and what's it going to be 5 years from now? What do you think is going to happen if things don't change?
Well, it's really hard to predict the future, but if we look at the past and what's happened over the last several years, my biggest concern for the next couple of years is that we still aren't going to have a stabilized market, because as we continue to lose carriers writing coverage on the federal exchange, that obviously creates turmoil within the market that's in that particular district or in that particular region, and that creates a lot of chaos, and where there's chaos, it's hard to price products. Where that happens, obviously, it's the consumer in the end who gets harmed because they're going to pay more, or they're going to have, as has been stated by some of my colleagues, their shrinking provider network, as we're seeing also in Ohio, where we just don't have the provider networks that consumers in Ohio are used to. So my concern over the next couple of years, where our early study that we commissioned in 2011 may have predicted that the market would stabilize by now. Unfortunately, that has not happened. And I'm not certain that that's going to happen in the next year or two either.
Well, it hasn't stabilized, and you know what's interesting about your testimony is it's gotten worse. And very recently it's gotten worse. So I'm looking at your testimony here. 17 companies in 2016 were approved to offer health care on the federal exchanges. Only 11 have decided to offer plans in 2017. Is that right?
That's correct.
So here we're at a period where you would have expected some, as you say, stabilization. Instead, you got just the opposite. And we've got 88 counties in Ohio. How many now only have one insurer?
So we have, let me find my numbers.
I was doing the math when you were talking about it. I think it's about...
I have the map.
About 25% of our counties have...
19.
Yeah, about 25%, I think.
Yes.
Have only one insurer. And, you know, I know that Again, it's a complicated area. There's lots of debate about, what we do, but just the lack of choice and the lack of competition. As I said, it relates to cost, but it also relates to quality of care. Recently, there was a group called the Kaiser Family Foundation that put out some estimates on this, and they're saying 19% of enrollees could have a single insurer by next year, 2017. They talk about the increase in costs substantially, double-digit increases in costs for people. They just can't afford it. 86% of Obamacare premiums were subsidized by tax dollars. So people say, well, I'm not on the exchange, because most people aren't on the exchange. It doesn't affect me. Well, it does affect all of us because we're all taxpayers. But the other thing that's happening in Ohio, and I'm told it's happening around the country, is that these insurers who can't make a profit under the exchanges because of the way they were structured are doing what? They are all staying in business. They're either leaving the exchanges, which, as you see, Aetna just left Ohio, as you reported a few weeks ago, but they're also cost shifting, right? So if you are a person in an exchange plan, the bad news is your costs are going up dramatically. Deductibles, co-pays, premiums, everything. If you are being subsidized by that, that helps you, clearly, but then the taxpayers are obviously paying that. But then also, we have the situation where if you're in an employer-based plan, which is where most of us are, you're seeing an increase in yours as well because these companies aren't going out of business, right? And do you have any evidence of that in Ohio, that there's cost shifting from the insurance companies who can't make it on the exchanges because they're losing money? And I assume, we have numbers on those. I know Anthem, for instance, loses money in Ohio and other states that they're in, but these companies aren't in trouble because they're cost shifting onto the private employers. That's a concern that's outside of all what we're talking about today, really.
Right. Senator Portman, I think it was Aetna, when they made their announcement, they were pulling out of many markets across the country, had announced a $400 million loss on their federal exchange business.
Wow.
And so I think that just using that number, clearly there are some insurers that are finding it very difficult. The populations are sicker in the pools than they expected, and they are having a hard time with the premium increases to keep up with the actual costs. I think one of the things that hasn't been said here, if I could, what's not been dealt with is the cost of health care. And premiums are driven by the ultimate cost of health care. And so where we originally thought that the Affordable Care Act, or Obamacare, was going to place some emphasis on addressing the cost of health care and reinforcing healthy behavior and getting people healthy and keeping them healthy instead of only treating them when they're sick, that's not what we're seeing happen in the marketplace. So the exchange business, there are certainly some insurance companies that could write it in a profitable way, but I think that more of them than not are finding that it's a loss for them. And so they have to make a conscious decision. They have to make a business decision. Is it such that they can continue to offer health insurance on the federal exchange, even though they're writing it at a loss? And then if they decide to do that, how long can they continue to bear those losses before it ultimately is a decision they can't do it any longer?
Well, again, my time's expired, but I really appreciate your expertise in being a CPA and understanding how insurance works. And then, as you say, looking at these broader dynamics in healthcare, which was not done in the Affordable Care Act, unfortunately, is, that's what we have to do in this place. And we got to do it on a bipartisan basis, unlike last time. And we got to come up with something that actually makes sense in the real world. And so you do have the ability to provide people with affordable, high-quality health care. Thank you.